Crisis intervention. In severe depression, talking about withdrawn behavior. So, first is depression. It is a condition in which there is an alteration in mood that is expressed by feelings of sadness, despair, and pessimism. There is a loss of interest in usual activities, and somatic symptoms may be evident. There can be changes in appetite and sleep patterns. This is common. Then, how do I know if I am depressed? Depressed people feel down most of the time for at least 2 weeks. We all are facing sadness or lows in our mood, but the person who are depressed, they will feel the following symptoms for the next 2 weeks consistently. They have at least one of these two symptoms. They no longer enjoy or care about doing the things they used to like to do, and they feel sad, down, hopeless, or cranky most of the day, almost every day. Depression can also make you lose or gain weight, sleep too much or too little, feel tired or like you have no energy at all without doing anything, feel guilty or like you are worth nothing, forget things or feel confused, move and speak more slowly than usual, act restless or have trouble staying still, think about death or suicide most of the time. Then talking about crisis. Well, crisis, it is any event or period that will lead or may lead to an unstable and dangerous situation affecting an individual, group, or all of a society. Crises are negative changes in human or environmental affairs, especially when they occur abruptly with little or no warning signs. Then crisis in case of severe depression. Some cases of depression are more severe with intense symptoms that may include significant changes in appetite. The person may eat a little or eat lot. Then weight loss, sleep problems. The person may have sleep problem in initiating the sleep or staying asleep, or they may sleep completely normal but they wake up early in the morning. Social isolation or withdrawal, frequent thoughts of death and suicide. So these are the symptoms that can be evident in case of severe depression when the person is suffering from the crisis. Such depression can be paralyzing because the person is not at all getting out of the bed, getting out of their house. The person may isolate themselves and have trouble getting out of the bed or leaving the house. Social withdrawal refers to avoidant or socially restrained behavior. Then withdrawal behavior. When someone feels depressed, they might have so many negative feelings that facing a social event or even talking to a friend can seem overwhelming. So what they are doing, they are avoiding getting socializing. They may not be able to do anything or even get out of the bed. Depression can make it hard to cope with anything, especially the daily task of life. People tend to avoid social situation because they don't know how to cope with others, and withdrawing helps minimizing their anxiety. Then the basic assessment of crisis, how we are going to know that the person is suffering from the crisis. First is home confined lifestyle. The person will completely confined to the home, will not go outside, consistently and repeatedly refusing to leave the house or personal space. The person will remain in their house or in their room only. Consistently avoiding interacting with people, including the family members or the close friends. Lack of motivation to attend school or work. Poor activities of daily living. This includes hair combing, brushing or bathing, anything that a person usually do in their daily life. All these things will be hampered. Significant changes in dietary pattern. The person may eat a lot or they will eat nothing. Then crying spells. Then talking about the management, how we are going to manage the crisis situation in case of severe depression. So first is home based management. Identify the crisis as soon as possible, as we have discussed about what are the signs and symptoms that a person show when they are in crisis. So we have to be observant, we have to observe that yes, these all things that the patient or the person is suffering. So we have to identify the crisis as soon as possible. Be a good observer and assess each and every behavior of the person. Be a good listener for their concern and share supportive input, because most of the time it happens the person may express what they are feeling, how they are feeling low or downs in the mood. So we have to be a good observer and a good listener, and we have to interpret what the person is trying to tell us. Be aware that often suicidal behavior is impulsive, as the person in severe depression has suicidal thoughts or the thoughts of death. So we have to be observant, and being a good listener, we have to just analyze that the person is having some suicidal ideations. Remove any weapons, medications or other means that might be used to harm. Anything that can cause harm to the person, including straps that can be used as strangulations, or alcohol or piled up medications, or any sharp object, all these things need to be removed from the surrounding of the person, because the person can harm themselves. Get rid of the stock pills in the house, as the person can use those stock pills as the source of overdose, or they can overdose those pills and commit suicide. Address what causes the person to withdraw from his social environment. We need to identify what is the exact problem, why the person is avoiding the social situations, because they may have some kind of guilt, or they may have other kind of perception what we or you as a person may not understand. So we have to understand what the person is trying to tell or what they are going through. Engage the person in activities so that it can be used as diversional for the person. The person can divert their mind. Then get them out of the house, get some fresh air and move out of the house with friends, family members. Do healthy activities together. It's not like we have to indulge the person in activities. We also need to be indulged in the activity with the person. Push the person for professional help. Contact the healthcare professional immediately to manage the situation at early stage. Now the role of nursing professionals. Role of nurse. Develop a trusting relationship with a client. Show empathy, concern and unconditional positive regard, as the nurses are the one who spend lot of time with the patients. So being a nurse, you have to develop a trusting relationship, you have to develop a rapport. Convey an accepting attitude and encourage the client to express their feelings openly. Unless and until the patient is completely comfortable with you, they are not going to tell everything, each and every thought what they are having. So it is our prime responsibility to have a trusting and relationship, and we have to build a rapport with the patient. Assess for risk of suicide or harm. Then create a safe environment by removing all the sharp objects or everything that can cause harm to the person, including any straps or alcohol or piled up medications. Perform room searches as deemed necessary just to ensure the safety of the person. Maintain special care in administration of medication. This prevents saving up to the overdose or discarding or not taking the medication, because many times it happens the person may not take the medication and they will use it as the source to commit suicide. They will overdose with those medications. Now listen actively to the client's obsessive themes, no matter how absurd or incongruent they may seem. Assist client to gain control of overwhelming feelings and impulses through verbal interactions. Assist the client in performing activities or daily living. Initially, we have to assist the client to just accomplish all the ADL, like that is the activities of daily living. Later on, we have to encourage the client to be independent in performing these activities. Encourage the client to independently perform activities of daily living. Monitor the intake output chart, and weight monitoring is necessary because the person is not at all taking any food, or we have to monitor the weight also, because the person is not taking food, the person may be overeating or they are not at all eating. So weight monitoring is necessary. Encourage to interact more with family members and friends. Encourage to participate in group activities. Provide opportunity to client for active participation in group discussions. Give reassurance and information, that is the psychoeducation. Psychoeducation plays a vital role in making the person out of this crisis situation, because we can educate them what they are going through, what is normal and what is abnormal. So what are the limits in which the person have to behave, or what are the things that a person usually do, what are normal, how the person goes down or they feel low in their life, so how can they come out of these things. All these things need to be educated. Then prevention of crisis. How to prevent a crisis situation? Have a regular healthy conversation to get an idea about client's feelings and thoughts. Keep the client engaged in activities so that you can divert the mind of the person. Keep an eye on client's action and behavior. Be observant and be a good listener to just analyze what the person is thinking or how they are behaving. Have a regular follow-up with the treatment what they are having. Never miss or discontinue the medications abruptly without consultation, because when you are just discontinuing the medication without any consultation, or abruptly you are discontinuing the medication, this can just accelerate your symptoms or exaggerate your symptoms. Then encourage to regularly attend the therapy sessions. So this is all about the crisis intervention in case of severe depression, that is the withdrawn behavior. Thank you.